Hi there and welcome back. Let's review pulmonary fibrosis today. We'll get into the reasons or the causes, statistics or the data that we know, how do we diagnose, complications, how do we treat, and the bottom line underwriting that we need to do while dealing with customers with history of pulmonary fibrosis. Pulmonary fibrosis is a respiratory disease characterized by presence of scar tissue in the lungs. The disease starts to cause the thickening and stiffening of the tissue, which ends up turning into fibrosis and causing difficulties in the lungs to properly transport the oxygen into the bloodstream. The lack of oxygen is responsible for symptoms like shortness of breath, a persistent dry and hacking cough, fatigue and weakness, discomfort in the chest, loss of appetite, unexplained weight loss, and clubbing of the fingers. The scarring associated with pulmonary fibrosis can be caused by a multitude of factors. But in most cases, doctors cannot pinpoint what's causing the problem. When a cause cannot be found, the condition is termed idiopathic pulmonary fibrosis. So, what causes this disease? Pulmonary fibrosis can be caused by an autoimmune disease such as rheumatoid arthritis or scleroderma, or by certain muscle diseases including polymyositis, dermatomyositis, and antisynthetase syndrome. Occupational and environmental exposure to toxic substances can cause irritation of the cells in the lungs and result in scar tissue. In many cases, patients who develop pulmonary fibrosis were exposed to a wide variety of inorganic dust, including asbestos, silica, coal dust, beryllium, or hard metal dust. There are also medications and drugs that can cause lung damage and pulmonary fibrosis. Patients who undergo radiation therapy can suffer from it depending on how much of the lung was exposed to radiation, the total amount of radiation administered, whether chemo or chemotherapy also was used, and the presence of underlying lung disease. Similarly, chemotherapy, drugs designed to kill cancer cells including methotrexate or Traxel and cyclophosphamide or Cytoxan, can cause damage to lung tissue. Antibiotics used to treat heart conditions like nitrofurantoin and sulfasalazine, as well as the seizure medication phenytoin, are also known to cause pulmonary fibrosis. About 10 to 15% of those with an idiopathic form of pulmonary fibrosis have another family member afflicted by the disease. This is called familial pulmonary fibrosis or familial interstitial pneumonia. A number of genes and genetic variants have been identified that are associated with the development of pulmonary fibrosis. Let's move on to the statistics. Idiopathic pulmonary fibrosis is more likely to affect men than women. Another data suggests far more smokers and former smokers develop pulmonary fibrosis than do people who have never smoked. How important it is for those who are smoking to think about this, and better they stop smoking. Pulmonary fibrosis can occur in patients with emphysema. Although the pulmonary fibrosis has been diagnosed in children and infants, the disorder is much more likely to affect middle-aged and older adults. Okay. How do we diagnose? Many tests including physical exam, chest x-ray, CT scan, echo, pulmonary function test, lung tissue biopsy, bronchoscopy as well as blood test to rule out other conditions are frequently used. What are the complications? Include blood clots in the lungs, a collapsed lung or lung infection, increased risk of lung cancer, right-sided heart failure or core pulmonary hypertension as well as respiratory failure are the frequently encountered complications while dealing with pulmonary fibrosis. How do we treat pulmonary fibrosis? Can be medications, pulmonary rehabilitation, oxygen therapy and lung transplant. So that is about pulmonary fibrosis. How do we underwrite? As far as underwriting goes, follow your underwriting manual and internal company specifics that your company wants you to follow. Let's take a quick break here and see you soon. Take care. Bye now.